You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. I'm Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Well, following up on last episode about stretching, I'm also going to talk to you about something similar and along those same lines. And today's topic is going to be balance and balance training. So balance training is extremely important, especially as we age. And the reason for that is the worst case scenario with a fall is a significant injury. So if you fall and hit your head, you can have a bleed in your head. This is extremely increased if you're on blood thinners for other reasons like a heart condition. More commonly in the orthopedic world, we see people after falls that results in a hip fracture or wrist fracture or some other type of injury. And those injuries lead to potentially the need for surgery and other risks, including death. We see actually a large number of people that have hip fractures in the United States that will die in the hospital or die in the first year after their hip fracture. And it's not necessarily from the bone break itself, but due to the surgery at the age that they are at when they fall, they may be prone to things like strokes and heart attacks, pneumonia, urinary tract infections, blood clots, or other issues that can lead to a significant complication or even death. So balance is something that we should all work on. And it's important to understand as we age, there are things that happen physiologically to our body that we can't necessarily stop. But you may work on certain things, and that may slow the progression. So what I mean by that is as we age, our sense of balance can change. And that can occur for multiple reasons. Sometimes people have issues with their inner ear, and that can lead to vertigo or other things that will result in balance not being as good as it once was when we were younger. Also, our vision changes. So we may not necessarily see that step in the curb or the root in the yard or even something at night walking across a parking lot. So we're not prone to pick up our foot and we trip and stumble. The other thing is our muscles may not react as quickly. So as we are younger and we trip and we kind of catch our toe and we stumble, and you'll see a younger person kind of trip and they'll take one or two quick steps and they right themselves. As we get older, sometimes that little trip or catching of the toe can then lead to you starting to go down and you can't stop it. You've lost the ability to quickly right yourself. And the other thing that can occur is something called neuropathy. And most commonly, we see this with diabetes, but you can also see it with certain back conditions and other diseases, and it's the loss of sensation. So if your feet lose the ability to sense where they are in space, this can change the way that you walk, and that can make you a lot more prone to falling. So physiologically, we may not necessarily be able to change our eyes or change neuropathy or change an inner ear problem. You may talk to your doctor and there may be treatments for your particular problem or disease that may help those things, but they may continue to occur. So what we can do is work on balance and work on the things that we can do to prevent those balance kind of abilities from going away too quickly. So how do you do this? Well, the simplest thing actually is just standing on one leg. I never recommend to my patients to do this at home on their own. This is one where I typically will send them to a physical therapist because this way you have somebody there to protect you, and everybody may progress differently. So you may start with things such as standing on one leg, but the therapist is there to protect you. When you're doing these at home, you have something to hold on to, and you also want to make sure that you're not surrounded by things that could injure you if you do stumble. But by picking one foot up and standing on the opposite leg and then switching, what you may find in the beginning is you can only do that for 1 or 2 seconds. And then over time, you might be able to do 30 seconds or 60 seconds. Now, there's other things where a therapist may use a ball that's deflated or certain special mats where you're standing on these things which are meant to move And what you're then doing is working what's called proprioception. So it's sort of your ability of your knees and your ankles and your hips and your back to kind of know where you are in space. And you teach the muscles and your center of balance to react to those subtle changes. You'll even sometimes see really fancy, sort of more high intensity balance exercises. A lot of younger kids use these, especially if they're into board sports such as skateboarding, surfing, or snowboarding. And there's all types of variations on these boards. These are very advanced. These are things I do not recommend to my patients to go out and buy, but you may see some modification of this with a physical therapist or a trainer. And what it's doing is allowing you to find your center of gravity and move yourself back and forth to improve your ability to know where you are in space, which essentially improves your balance. Now, if you do go down that road and you start to see some improvements and you basically sort of pass the introductory type of stuff, you work with your physical therapist, your trainer, there's lots of really interesting balance classes. So depending on your age and your ability, you may be able to find local balance classes, and you can work in these classes with other individuals in a safe, controlled environment, which again can teach you different tricks and tips and how to improve your balance, muscle strength, proprioception. Now, there are options online, but again, when you start this, if you go online and do these at home, there's a greater risk if you're not being protected or guarded or watched carefully that you may injure yourself. So I strongly recommend against that as a first option, but it is something that if your trainer or your physical therapist thinks that you're safe and ready, they may recommend some other things just to kind of mix that up. Now, as far as simple balance things, as far as a protective thing, is as we get older, if we're having issues with falls, if we're having issues with tripping and stumbling, you really want to make sure that your house is safe. So you don't want to have big, thick throw rugs where you could potentially catch your toe. You want to make sure that there's good lighting, that you're not walking around where it's dark. You also want to make sure there's not cords and things. And be aware if you have pets like small cats and dogs, you want to make sure that you're aware of where they are. It's notorious that they're trying to be nice and get close to you, but if you're not aware that they're there, it's very easy to trip and stumble over your pet and then fall and injure yourself. So number one important thing is let's try to prevent falls. Simple things that you can do is just looking around your house and making sure that you don't have throw rugs or cords or other things that may be a hazard to you, potentially tripping and falling and going down. And then talk to your doctor or healthcare provider, see if they can refer you on to a physical therapist so you can get some balance training. Look into local balance classes. And then once you learn in a safe environment, and you're taught a home exercise program, really try to work on continuing to do these balance exercises on a regular basis so that you can constantly and consistently improve your body's ability to have better balance throughout the day and hopefully prevent a fall and prevent an injury. And if you have someone that would really benefit from this, talk to that person. It would be good to have a partner, and you can go through these balance exercises and balance teaching together, or refer them on to this podcast if you think that they would benefit from that information. But thanks again for listening. Stay safe. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.